Hey everyone, today we're here to help you understand that pain in your back. Back pain is a widespread issue that affects millions of people around the world. It's not just a minor inconvenience, it can be a major disruption to your daily life. Back pain is one of the most common reasons people seek medical help or miss work. In fact, it's estimated that around 80% of people will experience back pain at some point in their lives. This makes it one of the leading causes of disability worldwide. It can have a huge impact on your daily life, making even simple tasks feel impossible. Imagine not being able to pick up your child, carry groceries, or even get a good night's sleep because of the pain. It's not just physical. It can take a toll on your mental health as well. Now, I know firsthand how debilitating back pain can be. I've seen patients who are athletes, office workers, and even stay-at-home parents who struggle with this issue. It's not limited to any one group. It can affect anyone, regardless of age or lifestyle. Whether you're an athlete pushing your limits or just trying to get through the day, back pain can really throw you off your game. Athletes might find it hard to train, while office workers might struggle to sit through a workday. Even simple activities like walking or standing can become a challenge. That's why we're going to walk you through a checklist to help you figure out what might be causing your back pain. This checklist will include common causes like poor posture, lack of exercise, and even stress. We'll also talk about more serious conditions that might require medical intervention. Think of this as a starting point to begin understanding your body and having a more informed conversation with your doctor. Knowledge is power, and the more you know about your condition, the better equipped you'll be to manage it. We'll cover some common causes, red flags to watch out for, and when it's absolutely crucial to see a medical professional. For example, if you experience numbness, tingling, or loss of bladder control, these are signs that you need to seek immediate medical attention. Remember, this video is not a substitute for professional medical advice. While we aim to provide valuable information, it's essential to consult with a healthcare professional for a proper diagnosis and treatment plan tailored to your specific needs. If you're experiencing back pain, it's always best to consult with a healthcare professional for a proper diagnosis and treatment plan. They can offer personalized advice and recommend treatments that are most effective for your condition. So stay tuned as we dive deeper into understanding back pain and how you can take steps to alleviate it. One of the first steps in managing back pain is to identify the root cause. Sometimes it's as simple as poor posture or a lack of physical activity. In other cases, it might be due to an underlying medical condition like a herniated disc or arthritis. Gentle stretches and exercises can often help alleviate minor back pain, but it's crucial to do them correctly to avoid further injury. Good posture is another key factor in preventing and managing back pain. Whether you're sitting at a desk or standing for long periods, maintaining proper alignment can make a significant difference. An ergonomic office setup, including a supportive chair and a desk at the right height, can help reduce strain on your back. Other methods like using a foam roller or getting a massage can also provide relief. These techniques help to release tension in the muscles and improve blood flow, which can aid in the healing process. However, it's important to consult with a healthcare professional before trying new treatments to ensure they're appropriate for your condition. Stress management is another crucial aspect of dealing with back pain. High levels of stress can lead to muscle tension and exacerbate pain. Practices like meditation, deep breathing exercises, and mindfulness can help reduce stress and improve your overall well-being. Don't forget the importance of a healthy diet and staying hydrated. Proper nutrition can support muscle health and reduce inflammation, which can help manage back pain. Drinking plenty of water and eating a balanced diet rich in fruits, vegetables, and lean proteins can make a big difference. Lastly, ensure you're getting enough rest and sleeping on a supportive mattress. Poor sleep can worsen back pain, so it's essential to have a comfortable sleeping environment. A mattress that provides the right level of support and a pillow that keeps your spine aligned can help you wake up feeling refreshed and pain-free. By taking these steps and working closely with your healthcare provider, you can manage your back pain more effectively and improve your quality of life. Remember, you're not alone in this journey, and there are many resources available to help you. Thank you for watching, and take care of your back. First things first, let's rewind to the moment your back pain began. Think back to what you were doing when the pain first started. Were you lifting something heavy? Maybe you were moving furniture or trying a new workout routine at the gym. Sometimes, the cause of your back pain is crystal clear. You lift something heavy with improper form and boom, your back screams in protest. Other times, it can be more subtle. Maybe you've been hunched over your computer for hours, and gradually that nagging ache in your back starts to set in. Identifying the trigger for your back pain is like finding the first piece of a puzzle. It gives us valuable clues about the potential structures involved and helps us tailor the right approach for you. So take a moment to think about what you were doing when the pain started. Was it a sudden sharp pain, or did it build up gradually? Every detail matters. Now, let's dive deeper into the type of pain you're experiencing. This is where things get interesting because the characteristics of your pain can tell us a lot about what might be going on beneath the surface. First up, let's talk about muscular pain. This type of pain is often described as a dull, aching sensation that might feel like a tight knot or a deep muscle soreness. Think about the feeling you get after a tough workout. That's your muscles telling you they've been challenged. Muscular back pain is incredibly common and can be triggered by various factors, from poor posture and overuse to muscle imbalances and even stress. The good news is that muscular back pain often responds well to conservative treatments like rest, ice, compression, and over-the-counter pain relievers. However, if the pain is severe, persistent, or doesn't improve with home remedies, it's essential to consult with a healthcare professional to rule out any underlying conditions. So, you've thought about what you were doing when the pain started, trying to pinpoint the exact moment it began. Maybe you were lifting something heavy, or perhaps you were just sitting in an awkward position for too long. It's crucial to recall these details because they can provide significant insights into the nature of your pain. And if it feels like a muscular pain, it might be due to overexertion or strain. Muscular pain often feels like a deep, aching sensation that can be quite persistent. Now let's dive deeper into the type of pain you're experiencing. Understanding whether your pain is constant or intermittent can be a game changer in diagnosing the root cause. Is it a constant companion, always there lurking in the background of your day, making every movement a challenge? Constant pain can be incredibly draining, both physically and emotionally. It can affect your mood, your ability to concentrate, and even your sleep. Or does it come and go, appearing suddenly and then disappearing just as quickly? Intermittent pain can be just as disruptive, catching you off guard and making it difficult to predict when you'll feel okay and when you won't. This distinction is really important information for figuring out what's going on. Constant pain might suggest a chronic condition, while intermittent pain could indicate an issue that flares up under certain conditions. Think about it like this. Imagine a constant, dull ache. This type of pain might suggest something like a muscle strain, where the muscle fibers are continuously irritated. It's like a persistent reminder that something isn't quite right. Muscle strains are common and can occur from overuse, improper lifting techniques, or even from a sudden awkward movement. The pain is usually localized and can be alleviated with rest, ice, and over-the-counter pain relievers. Now contrast that with a sharp pain that shoots through your back when you move a certain way. This type of pain is often more intense and can be quite alarming. It might make you stop in your tracks and catch your breath. That might point to a pinched nerve or a problem with a disc in your spine. These conditions can cause severe pain that radiates down your legs or arms, depending on the location of the issue. It's a different kind of pain that requires a different approach to treatment. See how understanding the type of pain helps us narrow down the possibilities? By paying attention to the characteristics of your pain, you can provide your healthcare provider with valuable information that can guide the diagnostic process. Keep in mind that this is just a general guide, and everyone experiences pain differently. What feels like a dull ache to one person might be described as a sharp pain by another. Pain is subjective, and it's important to communicate your experience as accurately as possible. But trust me, paying attention to these details will give you and your doctor valuable clues. The more specific you can be about your pain, the better equipped your doctor will be to help you find relief. Remember, your body is constantly communicating with you through things like pain. It's a signal that something needs attention, and it's important not to ignore it. Don't ignore the signals it's sending. Ignoring pain can lead to more serious issues down the line. It's always better to address pain early on rather than waiting for it to become unbearable. Let's move on to the next important question. Understanding the nature of your pain is just the first step. There are many other factors to consider, such as the duration, intensity, and triggers of your pain. By taking a comprehensive approach, we can get closer to finding the root cause and developing an effective treatment plan. So you've been dealing with this back pain, but how long has it actually been sticking around? Has it been a few days, a few weeks, or even several months? This is a key question because the duration of your pain can tell us a lot about what might be going on. When you visit a doctor, one of the first things they'll ask is how long you've been experiencing the pain. This helps them determine the nature of your condition. We doctors like to classify back pain as either acute or chronic. This classification isn't just medical jargon, it plays a crucial role in how we approach your treatment plan. Acute pain is like that sudden jolt when you accidentally step on a Lego barefoot. Ouch, right? It's immediate, sharp, and often very intense. This type of pain is usually a signal from your body that something is wrong and needs immediate attention. It comes on quickly, and it usually doesn't last longer than 6 weeks. Acute pain is often the result of an injury, like a muscle strain or a sprain, and it tends to resolve as the injury heals. Now, chronic pain is a different story. Unlike acute pain, chronic pain lingers. It can be less intense but more persistent, and it can significantly impact your quality of life. This type of pain is more of a long-term guest that overstays its welcome. Chronic pain can be a constant companion, affecting your daily activities, your mood, and even your sleep. We're talking about pain that lasts for 12 weeks or longer, even after the initial injury or cause might have healed. This kind of pain can be due to a variety of factors, including underlying medical conditions like arthritis or nerve damage. Understanding whether your pain is acute or chronic helps guide treatment decisions. For instance, the approach to treating a recent injury is very different from managing long-term pain. Acute pain might just need a little rest, ice, and maybe some over-the-counter pain relievers. These simple measures can often be enough to alleviate the pain and allow your body to heal. Chronic pain, though, often requires a more comprehensive approach, like physical therapy or other interventions to help you manage it effectively. This might include a combination of treatments such as medication, physical therapy, lifestyle changes, and sometimes even psychological support to help you cope with the emotional toll of long-term pain. In addition to medical treatments, alternative therapies like yoga, meditation, and acupuncture can also be beneficial for managing chronic pain. These practices can help reduce stress and improve your overall well-being, which in turn can help alleviate pain. Support groups and educational resources can also be invaluable. Connecting with others who are going through similar experiences can provide emotional support and practical advice for managing your pain. Making adjustments to your daily routine can also make a big difference. Simple changes like setting up an ergonomic workspace, taking regular breaks, and incorporating gentle exercise into your day can help manage both acute and chronic pain. Remember, the goal is not just to relieve pain, but to improve your overall quality of life. By understanding the nature of your pain and working with your healthcare provider, you can develop a personalized plan that addresses your specific needs and helps you live a more comfortable, fulfilling life. Whether your pain is acute or chronic, it's important to stay proactive and engaged in your treatment. Don't hesitate to seek help and explore different options until you find what works best for you. Your well-being is worth the effort. All right, guys, let's talk about when back pain crosses the line from a nuisance to a serious medical concern. Remember, I'm not trying to alarm anyone, but it's crucial to know when to seek immediate medical attention. One major red flag to watch out for is any numbness, tingling, or weakness in your legs or feet. These symptoms, especially if they come on suddenly or worsen over time, could indicate a problem with your nerves. For example, a herniated disc pressing on a nerve root in your spine can cause these symptoms. Now, I know what you're thinking. A herniated disc sounds scary. While it's true that a herniated disc can be painful and require specific treatment, it's often manageable with conservative measures like physical therapy, medications, and sometimes even just time. The key here is to catch it early before it potentially causes any lasting nerve damage. So, there you have it. We've covered a lot of ground in this video, from the different types of back pain to those crucial red flags you should never ignore. Remember, this checklist is designed to help you better understand your back pain, but it's not a substitute for professional medical advice. If you're experiencing back pain, the best course of action is to schedule an appointment with your doctor or a qualified healthcare professional. They can properly diagnose the root cause of your pain and recommend the most effective treatment plan for you. Don't forget to give this video a thumbs up if you found it helpful, and subscribe to the channel for more informative videos on health and wellness. And as always, thanks for watching.